Hello, and welcome to the Postpartum Years podcast. I am your host, Dr. Ellen Kramp. I'm a physical therapist and a pelvic health specialist. Joining me today is Liz Jones from Jones Physical Therapy in Bismarck, North Dakota. She is also a physical therapist and a pelvic health specialist, and she is the goddess of hemorrhoids. Not that she wanted to be. I don't know that many people aspire to be the goddess of hemorrhoids, but she just landed there. And I know for one, I am very grateful that she did. And she's an amazing pelvic health specialist. So welcome, Liz.
Thank you. It's humbling. Yeah, it's funny when I first looked into doing this, I had a physician I knew well. And I said, what do you think? Our physician's going to question me. Am I opening myself up to, litigation, whatever. And I just remember he looked at me and he goes, "Are you sure you want to do this?" And I was like, "Yeah, what? Why? I think so." And he goes, "Do you really want to be known as like the hemorrhoid girl?" And I was like, yeah, I think I'm good with that. And literally probably, 10 years into it, I was super sick, went to walk in and I'm like, feel like I'm dying. And this doctor goes, "Liz Jones, do you have Jones Physical Therapy?" I said, "Yeah." He goes, "Oh, you're the hemorrhoid girl." And I was like, there it is. Yes, I'm the hemorrhoid girl. I'll take girl over goddess, but yes, I'm the hemorrhoid. I'm the hemorrhoid lady in Bismarck and the region. Yes.
Yeah. All right. So let's start with telling people exactly what hemorrhoids are.
Yeah. So misconception. A lot of people will say to me, "Oh, I don't have hemorrhoids. I've never had those on the outside." Or "I don't have internal hemorrhoids. I only have external hemorrhoids." It's like, well, if you have external, you almost always have an internal. So my handy dandy hand is the best way I think to describe it. So I tell people all the time, if you think of this as your canal and this is that sphincter we see on the outside. So actually about this far up into the canal, there's this little faint white line, dentate line that's got a ton of sensation. And that's what tells us when there's any pressure there. Is this a gas, liquid, solid? What do I do with it? Because we all know if we can like sneak out a fart or, oh man, I got to get to the bathroom now. So that little sensation line tells us that. From there to the hair, to the outside, a ton of sensation and innervation to this area is highly sensitive. Here up, we don't have sensation. But literally about from here to here in that canal is where those internal hemorrhoids form. So hemorrhoids essentially are a failed vein. So we think of varicose veins in the legs. We can all picture what that looks like. Mary Ellen talks about this all the time. The valves fail, blood just sits there, can't get out. So essentially we have a lot of blood supply to this area. That hemorrhoid is essentially a failed vein in that canal. So that blood is pooled there. And then you think about the lining of this area here actually looks very similar to the lining of the cheek of your mouth. It should be soft and supple like that and smooth. What happens when that vein just keeps filling with blood? Over time, that integrity of that tissue just keeps getting stretched, and pretty soon it's failed and it's just hanging out there. So I'll tell people, it's like if you take a balloon and squeeze over and over, and eventually one spot weakens. So every time you squeeze the balloon, it bulges in that spot. That's kind of that hemorrhoid when it's got pressure behind it. If you let go of it, you can see it's a little bit loose there. And if you deflate the balloon, you can see it's actually wrinkly there because it's stretched out. So that's kind of a good visual. So essentially, internal hemorrhoids are failed veins in that canal. External hemorrhoids, I don't have a glove, should put a glove on. If you think about this tissue getting stretched out over time and bulging and being the weak spot, essentially what we see on the outside should be tucked up and in, nice and tight. What happens is if when this stretches out, it allows this tissue all the way down to kind of give. So then you've got this laxity. So then think about, you always have this like loose skin on the outside, or after every bowel movement, pressure, being on your feet a lot, all of a sudden you've got this bulge on the outside. So that's filling there. Did that answer it in a really
that answer it
you probably
very,
have a
very
better
well.
scientific answer to what a hemorrhoid is.
Oh, no, that's the scientific one. Most people are just going to be sitting there going,
yeah, vein pressure, average person has 6 to 8 of them in their canal. There you go.
Beautiful. Beautiful. All right. What are the symptoms? I know my dad used to have hemorrhoids, and he called them a bloody pain in the ass.
Yes. That's what they are. Yeah. Yes, they are. They're literally a pain in the ass. But what's interesting, kind of like, I feel like with every pelvic condition that we deal with, you can have all the symptoms, you can have one of the symptoms. And so it doesn't rule it in or out. You could have no symptoms with them. Sometimes I get in there and see a lot of things going on. We treat one site. They still have plenty in there, but their symptoms are gone. So the common things we see, I think the most notable ones, obviously people get the bulge on the outside. It's really painful. So when these ones up here throw an actual blood clot forms and that blood clot comes out, that's called a thrombosed hemorrhoid. And those are extremely painful because now that blood clot gets caught outside of that tight sphincter muscle and is incredibly painful. So protrusion on the outside, the bulging, bleeding is a common thing. Itching and irritation is something people don't always think of with hemorrhoids. Now, there can be other reasons people are getting itching down there, but that can be a one thing because there's just that constant irritation up in the canal to mucosal lining. And then that can cause a little bit of seepage that kind of causes that irritation. Or in my mind, we get a little bit of pressure on the sensitive tissue and it just doesn't feel right. The feeling of there's pressure in my rectum. So I tell people all the time, when I ask you right now, can you feel pressure in your rectum? And they're like, yeah, like, that's not normal. We should not feel pressure in our rectum unless there's gas, liquid, or solid sitting there, right? The sensation of I went to the bathroom, had a bowel movement, don't feel like I emptied all the way. There's still something there. Achy hip, tailbone pain is a huge one. We get a lot of people with tailbone pain. We kind of clear that first. Also fluctuations of bowels, of normal bowel movements, then kind of like, kind of constipated, then weird, greasy, squiggly poops, then, oh my gosh, I got to go. A lot of patients come in with IBS diagnosis and actually we get rid of their hemorrhoids and things go away. That feeling like you wipe and wipe and wipe and can't get clean, or you feel clean, you come back later and there's that smearing. Yeah, I just had a gentleman, my wife said I have to come in. My underwear are dirty again. And he came back a second time. My wife's much happier. I'm like, okay. Yeah, but there's so many of those weird bowel things. I think I got all of them. Yeah, constipation to diarrhea, because if the body starts getting impacted, it says, got to get rid of this. And then you'll get those weird flushes of diarrhea too. I think that's most of them.
It's quite a variety, and a lot of the stuff that we see in a traditional pelvic PT environment where we don't have access to the things that you have access to.
Yeah. And so many times I see even on, some of the conversations on Facebook or whatever, the PT blogs and conversations of therapists asking so many times, tailbone pain, what else do I do? It's like, hemorrhoids. And then for men, nocturia, actually, just because of their anatomy. For women, it doesn't make as much of a direct correlation. But for men, oh my goodness, we treat their hemorrhoids so many times, their frequency of nocturia almost goes to zero. Especially if they're that younger guy that you're like, doubt your prostate's the issue. Clear some of those things. If they have any hemorrhoid symptoms, we're like, let's start with that. And they look at you funny. Like, I promise I have a reason for it. I'm not just trying to talk you into doing this. And usually when we go through all the symptoms, they're like, oh, yeah, I do have a few of those things.
How quickly, after the treatment you particularly do, how quickly do patients notice the improvement?
Some patients swear as they walk out of the clinic, they feel better. Part of me thinks they're just relieved to not have a scope up their butt anymore. I do think the ones that notice immediate relief, I think there is that factor of a lot of tension and spasm in that sphincter, because the anoscope obviously holds that sphincter open for 7-8 minutes and kind of breaks some of that spasm too. But usually we tell patients it's going to take about 10 days for that to collapse all the way and for them to see how much relief they're going to get from that treatment we did that day. But many times it's a few days in, they're already noticing that, oh my goodness, I already feel my butt does feel lighter. Oh my goodness, I'm emptying more productively. I sit down, I just go, and I have a nice fuller bowel movement. I don't feel like I have to go back again 2-3 times.
Mm-hmm. Yeah. Now, I know you're very, very well aware of with the techniques that you use, but you use a machine that only a few people have access to.
Right.
How well are you aware of the other techniques that are out there for hemorrhoid? Because your machine's only for internal hemorrhoids.
Correct. Yeah. And people beg me to treat their external. I'm like, you would not let me near you with this needle and electric current where you have high amount of sensitivity. So the technique is called Keezy, and it is a machine where we go in rectally. We actually put current directly into that hemorrhoid. The chemical reaction happens, and essentially it collapses that hemorrhoid so blood can't fill there anymore. I actually am very fortunate. I've got good relationships with 2 surgeons in town. One a little more independent, one with one of the bigger hospitals. They do banding and they do the hemorrhoidectomies. I'm not real familiar with some of the other things out there, just because that's what's in our area. I will tell patients when the hemorrhoids are really, really large that this treatment may not reduce that size all the way. A lot of times people will get relief of symptoms, but if it's so stretched out and that hemorrhoid is so big internally, they might be a better candidate for banding. Because then it actually sloughs off that other tissue. So that banding is putting that band around like the base of the hemorrhoid and then cuts off all circulation. Essentially it dies and just falls off. Where we are, putting current in and it collapses into the wall. So we'll see a like tighter integrity of the walls. And we have the surgeons we refer back and forth off, and they'll say, man, there's so much going on here. I don't know where to start. Go see Liz first. And then we'll get them to a point and go, this one's not changing. One example, a gentleman, I kind of had forgotten that the doctor had seen him and said not to do banding. So we treated him. He did really well, but he had this one really large internal, zero other symptoms, except when he would go for walks, he was very active, that tissue would come out and it would drive him crazy, but no other symptoms. And I'm like, you know what? Did you ever talk to Dr. Kane about banding? And he goes, yeah, remember I went there, and he said, I don't even know where to start. You have a whole metropolis in there. Go see Liz first. So I'm fortunate that we go back and forth with that. And then the hemorrhoidectomy itself, my concerns with that is it's a really, really painful recovery. There is a little bit more scar tissue with that one, where I can see that on the canal walls, and I go in with the scope like, oh man, it's just really white. There's no blood flow there. And it's a major surgery.
And extremely painful.
Yeah. Yep. We do all we can before they have to do that one. But sometimes there's ones that they're just not responding, or the people who are really genetically prone to them. I'm like, you know what? We've tried this. I will continue to treat you as often as you want, but we're at a point where I should have seen more results by now. And maybe that's a better option.
It's amazing stuff, because in, the pelvic education world, they really don't give us much as far as what to do for any of that. It's, tell your patients to have more fiber and some more water and, don't sit on the toilet with your cell phone. And
and I kind of, when I talk with patients on the education of prevention, say they are someone who's just really genetically prone, right? So I kind of have three major things. Is there a pelvic floor dysfunction going on that you've got really, your pressure systems are off, right? You're bearing down too much to create the relaxation, whatever. So there's the pelvic floor muscle. Is that pressure system off, creating too much intra-abdominal pressure on those hemorrhoids? Are you genetically just prone to them? No matter all the healthy habits you do, you're going to get them. And then the digestive piece, is there's something going on digestively, constipation, and then I should say four things, I guess, because then also kind of with pelvic floor is, was there a recent pregnancy and labor delivery that caused these, or are you doing a lot of heavy manual labor all the time that, again, pressure systems are off? But then the ways I talk with patients to prevent, obviously, healthy, clean diet, moving. We know they've got to be moving for that healthy digestion and pelvic floor muscle relaxation, movement, and health. And then, the bearing down on the toilet. I don't care if you sit there for a little bit, but if the urge is there, like go walk around, right? But and then we do a lot of self-release, having them work on laying on their side, do that levator and I release, and then they can just straighten fingers, get a little bit of relaxation to that sphincter, just that awareness.
How much do you end up recommending fiber for people?
I always say I know enough to be dangerous sometimes with that. If they're eating a really crappy diet, I'm like, try some psyllium husk, but listen to your body. Because some people are like, I've done it and it made me worse. And I will say, do you have a naturopath or a functional medicine doc you work with on your digestion? Because yes, fiber can be helpful. And I think it's huge. I tell people, as a mom, when your kids play with kinetic sand, it's so annoying because it's everywhere. And then when you take the sand, you go around and daub it, and like get it all in one piece. And like, to me, psyllium husk is a great thing. It just is like the sweeper that keeps things moving, right? Like I can try to eat more fiber. I'm terrible with labels. I don't know how much fiber is in every food I eat. As much as I try to eat healthy, there's days where I eat trail mix and some water all day. It's like so I think it's a good thing. I tell people I think it's a good part of and it's a superfood, just take it at night before bed. But then I always tell them, look into it, see what works with your body. But I think fiber, water, breath, movement are huge.
Yep. I know there's a whole lot more to hemorrhoids from more physician standpoint, but I think I'll do another segment like just from the physician side of
Yes.
things. Yes. Because there's only so much we can do on our side, especially those of us who weren't blessed to be gifted your fabulous machine.
Well, and I will say too, in pelvic health, I think there's so many times we're seeing women postpartum who think they broke their tailbone in labor delivery. I hear it all. I think I broke my tailbone. It's probably an internal hemorrhoid, right? So I think it's just important to, again, do all the techniques we know to do, pelvic floor relaxation, getting them to not be tensing, there's all the great things for better bowel movements and less straining. But just knowing that ultimately if they have the smearing, the bleeding, the pain, the weird, that it could be a hemorrhoid, and just that, getting them to somebody who can help address it.
If pelvic PT fails,
and my patients have loved the hepatic vein maneuver, by the way. So Ellen came in and taught our whole team. And so all my hemorrhoid patients are like, oh, hold on. And they're loving it. So thank you. That's also a great trick for those that are thinking, suspecting hemorrhoids, to be doing some of those other techniques.
Yeah. Because that helps to drain the whole gut through the liver. So, all right, Liz, thank you very much for sharing all that info on hemorrhoids with us. And if you want to travel to Bismarck, which honestly is such a lovely place.
It is. We're kind of hidden. Yeah.
Yeah. In the middle of nowhere.
Yep.
But the airport's adorable. There are 4 gates.
Only 3 ever get used, by the way. I've never seen the 4th one ever used.
But if you wanted to go visit her in Bismarck, it is a lovely environment. She has the most beautiful clinic there and such wonderful practitioners. So, if you really wanted to try it, I would say she's definitely worth the trip.
Thank you.
Okay. So thank you very much for joining us. And I hope you get a lot out of this episode. We'll see you next time on the Postpartum Years podcast. Bye.